This week, backlash against the state's Medicaid fraud crackdown is growing, and affordability will be the watchword for 2026 elections. Welcome to the June 26th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Minnesota was back on the spotlight in Washington this week, headlining a House Energy and Commerce Committee hearing on fraud in Medicaid just weeks after 15 new fraud indictments were handed down in the state. GOP Representative Gary Palmer of Alabama scolded Minnesota's interim DHS Commissioner and Medicaid Director John Connolly as he sat in the witness chair.
There have been billions of dollars stolen from state and federal programs that should have gone to help people who legitimately need them. That's the shame of this. That's the tragedy of this.
Connolly reviewed the state's efforts to fight fraud for the committee, but also noted that the Center for Medicare and Medicaid Services had withheld millions in funding despite those efforts.
Medicaid is a foundation for our entire healthcare delivery system, including hospitals and nursing facilities, and major funding losses threaten to destabilize care for all Minnesotans. Recent federal deferrals of Medicaid payments to Minnesota have put our residents at severe risk. This is not an accounting dispute on a spreadsheet. These decisions affect Minnesotans with significant needs, people for whom a missed appointment, a gap in treatment, or an interrupted support service can quickly become a crisis.
So far, the focus in Minnesota has been on more than a dozen so-called high-risk services involving housing, disability care, and transportation, and not traditional hospital care, although some health systems say long-standing community service efforts have been impacted by a state funding cutoff that went into effect June 1st. Speaking of that cutoff, unhappiness with service cuts to disabled Minnesotans and other Medicaid beneficiaries has been growing louder. That included a public letter from a lawmaker last week telling DHS to improve its revalidation efforts, and a town hall in Big Lake held by another Republican lawmaker this week. CARE TV reported that hundreds of people showed up at a gathering organized by Options Incorporated after it was terminated from Medicaid programs in Minnesota. The nonprofit serves about 200 people with disabilities and said it got cut off despite complying with audit requests. State Senator Andrew Matthews called on state officials to speed up that process of auditing and confirming eligibility of existing Medicaid providers.
With many providers facing real harm in just a matter of weeks if this isn't turned around.
Options Incorporated said it was reinstated this week, but that others were caught in the same situation. Minnesota also rolled out a new set of applications for Rural Health Transformation Program funds, including a new Rural Clinical Fellowship Program that follows previous announcements for a Rural Physician Residency Training Program and a telehealth initiative. But NPR News said this week that the money isn't getting out yet and that it requires providers to spend their own money on a program, then get reimbursed. Winona Health CEO Rochelle Schultz told NPR she doesn't know the money will do much good even when it arrives.
It's not going to do anything to help with the Medicaid situation that's coming down the pike.
Applications for the next round of funding are due at the end of July. In other news this week, the Minnesota Department of Commerce reported nonprofits serving the individual health insurance market in the state, mostly in the MNCare program, expect to post double-digit premium increases for 2027. Medica is expecting a 13% boost, and Blue Cross Blue Shield filed for a 10% increase. Those headlines preceded comments from both DFL gubernatorial contender Amy Klobuchar and Senate DFL Majority Leader Aaron Murphy. Both told local interviewers that they expected affordability to be a leading political issue in this fall's elections. MinnPost noted that Klobuchar has been critical of the Trump administration and rising prices for food, oil, and other necessities. But Murphy told the Star Tribune that her caucus would be focusing on healthcare costs as part of its message to voters in 2026. She listed healthcare affordability as her caucus's top challenge and noted that Medicaid cuts would likely have a significant impact on affordability for tens of thousands of Minnesotans in the next year.
And some other items of note this week. A new report from CMS said that actuaries estimate U.S. spending on healthcare will reach $9 trillion annually by 2034, up from $5.3 trillion in 2024. That's an average growth of about 5.4% a year, compared to an average annual U.S. inflation rate of about 2.8% over the preceding decade, including the post-pandemic spike. Equally notable, CMS says that it expects healthcare to be an even bigger share of the overall economy, growing from about 18% of the economy now to about 20% by 2034. A CMS economist said this week that retail prescription drug costs will be the fastest growing spending category over the course of the agency's projection. It also says growing Medicare enrollment will likely offset the reduction in spending when Medicaid recedes starting next year. Also, a new analysis released this week by the Commonwealth Fund says cuts from last year's One Big Beautiful Bill Act will cut $197 billion in state economic activity by 2029 and eliminate nearly 1.7 million jobs nationwide, about half in healthcare. The decline is attributed to cuts in Affordable Care Act subsidies and SNAP benefits, but primarily to declines in Medicaid spending.
And that's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.